There we
Perfect.
go.
Okay.
All set. Okay, well,
We will
you don't
leave
need
you
our
to it.
faces on here, so.
Welcome to the podcast. Today, it's my pleasure to welcome Dr. Kendrea Jones, Director of Pharmacy at Arkansas Children's Hospital, to talk about really some of the unique opportunities and challenges in pediatric pharmacy. So, Kendrea, thanks for joining us.
Thanks for having me.
So let's start with some background for our audience. You took a little different path to get where you are. So tell us a bit about your career path and how you got to your current role.
Yeah, I often joke with our dean of the College of Pharmacy here in Little Rock, as well as probably telling my students never say what you won't do or what you're not interested in until you probably actually experience it. And probably just making sure you're taking advantage of like postgraduate training opportunities as well as any job that you have, because it's probably preparing you for a job you didn't even realize that you would end up in. So I'm, from Arkansas, went to undergrad in pharmacy school here in Arkansas, and then upon graduating, did postgraduate training, specializing in critical care. And while I was doing that residency, a position came available here at Arkansas Children's Hospital within the burn center, which was actually primarily an adult center within a pediatric environment. And at the time, when I was a third year pharmacy student, I remember adamantly telling our experiential ed office that I did not need a rotation at Children's, that I had been fortunate enough to work with one of the faculty members there, wrote a case report. So my first publication was actually voriconazole in pediatric patients and looking at pharmacokinetic levels. And so I was like, I don't need to do anything in the peds hospital. I'm not going to do adults. So it's amazing how it comes full circle. Ended up in the burn center, actually in a co-funded faculty position for about 12 years, where I taught pharmacy students, coordinated courses, but also served as a clinical specialist for that unit before transitioning into the department about 5 years ago as the operations manager. And now I'm the director of pharmacy for our Little Rock campus.
Fantastic. So how about Arkansas Children's itself? Give us a little overview of the hospital and the pharmacy service.
Yeah, so if you look at our system as a whole, we are the only hospital system within the state really focused and dedicated to pediatric care. So our mission, everything that we do is really around the focus around our pediatric patients. Our Little Rock campus has actually been in place for over a century, which is amazing. And then we opened up a campus on the northwest section of the state about 7 years ago. So I currently oversee the clinical and the pharmacy services here in the Little Rock campus, which is about 330 beds. We're a level 4 NICU, level 1 trauma center, have a significant hematology oncology transplant program as well. And then we have a research institute, as well as a really strong affiliation with our local colleges of pharmacy, medical school as well. And so when you look across all of our departments, we have about 130 FTEs that are really supporting our services across our inpatient pharmacy, retail pharmacy. Recently, we opened up a specialty pharmacy as well as investigational drug services. We have a number of clinics across the state. And then our campus actually is managing our 340B program for the system, as well as having a PGY1 and PGY2 residency program focused around pediatric care. We just kicked off a major expansion project. So as part of that expansion, we'll get a brand new retail pharmacy, but also opening up an ambulatory surgery center.
Wow, you've got a lot going on.
Yeah, lots of exciting things going on.
Having been responsible for pharmacy services at a children's hospital myself, I do know this population presents some unique challenges, but of course, with challenges come opportunities. So what's on your list as some of your most important challenges?
Yeah, I think when you think about pediatric healthcare in general, usually what comes to and first to mind is usually medication safety, right? I think we all are aware, pediatric patients are not just small adults, and so when you think about the complexity, the variety of the patients that we see, how many of those patients, from a pediatric care perspective, this is maybe the only place that they can come to, and so how are we managing their medications and doing it in a safe manner? Formulations always is a concern. And so, within our institution, we have the ability to compound the appropriate medications to get them to the right formulation for for those patients, but then as they leave, are we able to continue to provide that service? And then just resources. I think healthcare in general has had the most significant staffing shortages, unprecedented, the last few years. And so how are we looking at our resources? How are we building out that specialized knowledge base? Pediatrics does require, some significant knowledge base and to grow that for a specialized patient population. And so having enough resources and FTEs and staff for that. And then I would say the other piece that we've been heavily focused on is new therapies, right? So the new gene therapies and novel therapies that have been approved and are being approved in the future, how fast that is growing. Do we have the appropriate knowledge and competency to be able to provide those therapies in an efficient manner, as well as quickly to our patients?
Yeah, touching on or maybe expanding on that a little bit, certainly the pediatric population is very often on the cutting edge of gene therapy and some of these really high cost drugs. So what are you doing to address control and appropriate use of those agents?
Yeah, we were very intentional. Luckily, even before I came into the department, we had established some really good processes with Zolgensma and the SMA therapies and with that team. So a couple of years ago, we kind of expanded that. We developed a high-cost drug therapy committee as a subcommittee of our pharmacy and therapeutics committee. And that committee is really not necessarily focused on the clinical therapies as much. It actually is made up of members of our finance and revenue cycle team. So we have members from our prior authorization team there, as well as our contracting team. And so the whole goal of that high cost drug committee is really to try to make sure that not only our clinical team is aware of those therapies, but that our non-clinical team has an opportunity to be aware, learn more about the therapies, understand the reimbursement models that we're anticipating, so that as those therapies are approved, that group has already, put practices in place to make sure that we're ready to administer those therapies as soon as the clinical team is onboarded. So we now have a process as we identify a new therapy. The manufacturers are able to actually meet with that high cost drug therapy committee early on and start talking about, making sure that we've thought about all the reimbursement for Medicaid as well as private payers, making sure we understand the full course of those disease states. And so as they're thinking about single case agreements and things like that, that we're including all of that up front and having those conversations early on. So as those therapies become available, we're able to make sure we can manage those. And then we have an approval process where we work with our vice president of finance as well as revenue cycle. So they kind of give the final approval before we order those medications. After the clinical team has actually identified a patient, we have our prior authorization in place, just so that there's enough monitoring. And then through that high cost drug therapy committee, we're able to monitor the budget dollars associated with those therapies as well. So working really heavily with those teams, being very intentional with those relationships. And then the other piece that we've done is we actually have a manager within our department that is heavily focused on those. And so most of the procurement of those therapies as he helps handle most of that, so that we have at least a member of our team that those clinical teams can reach out to and know that we have some consistency amongst our leadership team.
Do you monitor, when you're monitoring outcomes, those high cost therapies, do those outcomes go back to that committee, or do those go to your P&T committee as the whole?
Right now, we don't have this as robust of a process. And I will say the newest probably sickle cell therapies, especially now as we have more than one agent for a disease state, is trying to figure out how we continue to monitor those therapies. A lot of that monitoring is occurring within the clinical teams themselves. So to your point, trying to be more transparent with our high cost therapy and P&T committee about those outcomes, especially as we start to have more than just one agent available for a specific disease state. And there's, I think, a little bit more competition, and it really does look more like a true formulary review where you're reviewing the available therapies and looking at both, not just the efficacy, but safety as well.
How about drug shortages? I mean, obviously that's an issue that plagues everyone, but sometimes with pediatrics, your options are a little bit more limited than in the adult population.
Yeah, the drug shortages the last few years have really been unprecedented. I don't think any of us in pharmacy have probably seen the number and level of drug shortages and the types of drugs that we never, I at one point we were acetaminophen, for example, or some of the antibiotics. I don't think any of us would have envisioned that we would have had issues with shortages associated with those types of medications. And so when you look at just drug shortages in a pharmacy, I do think one of the biggest things is the importance of well-trained purchasing coordinators and a purchasing team, and making sure that it's across the system, we're working really, really well. And then those relationships, previously most pharmacies probably had a few wholesalers that they ordered from. We always have our primary wholesaler, but we have relationships across multiple wholesalers now. So we're sourcing drugs from multiple locations to make sure that we can respond quickly to those drug shortages. And then I would say making sure you're using predictive technology. And anytime you can use an inventory management system, right, to help make sure you're monitoring your use and what are you needing. And then those predictive technologies being able to look at historical use and kind of determining where you need to increase your stock. And then the other part of that is Arkansas Children's for the last few years has actually been a coalition member of FLOW. If you're not familiar with FLOW is really an organization really focused around looking at supply chain medications and being able to manufacture those medications within the United States. And the FLOW coalition is really focused around pediatric medications and essential meds. And so we've participated in that coalition. We serve on their advisory council, really trying to give them some recommendations around where to focus some of that supply chain review and where they are manufacturing.
Yeah, I always laugh when we talk about drug shortages. That was one of my worst prognostications ever. When I was chief pharmacy officer at University of Utah, like 20 years ago, drug shortages first started to become prevalent, and Linda Tyler and Aaron Fox brought an idea to me to be the national clearinghouse for drug shortages to support ASHP and some of the GPOs with the information. And I said, yeah, go ahead and put the project together, but realize this will probably only last a year or two. Yeah, nailed it.
Yeah, exactly. The other part of that is how are you using your electronic health record too, right? Because you have to have the ability to really get communication out to your providers quickly too. So, how are you being strategic about your best practice advisories, the modification of therapy, being able to at least respond fairly quickly. And I think that's been the struggle a little bit the last few years is just that they are almost nonstop and stop. And so all of a sudden you go in to order something and now it's unavailable or it's been on allocation and you weren't expecting that. So really trying to figure out how you partner with especially your providers to make sure you can get that communication out quickly, especially if you're having to modify therapy or starting to restrict medications to certain patient populations and prioritizing those patients.
Yeah, absolutely. I'm going to pick up on the referral center concept that you mentioned. So being a major pediatric referral center, obviously you do get patients from all over the region, and many of them come from very rural areas, which does make it difficult for them to get some of those specialty medications that they need after they're discharged. And you said you're working to address that with your own specialty pharmacy operation. Tell us a little bit about what you're building there.
Yeah, I actually get really excited when I get to talk about our specialty pharmacy services, especially our relationship and our collaboration with VSOT. We got the support of our senior leadership team back in 2022 to engage with VSON and really do an initial review of the potential for a specialty pharmacy on our campus. And then we have a really good, robust process through our strategy office for business case planning. And so we did that in 2023 with the approval to move forward. So we just started implementation last fall. What I love most about the specialty pharmacy services and really the ability to bring that to our campus, but our patients is not really the financial impact. I think everybody knows there is significant financial impact. Specialty medications, right, are the most largest growing sector of pharmacy. It really is the impact to the patient experience and the team experience that I'm probably most excited about. We've been able to embed pharmacists and technicians within our clinics to really look at how we're making sure for our patients, how we're extending our services beyond just our normal retail services. And so when you look at just the way specialty pharmacy is going to change medication access programs for our campus. It's really setting the model for that. And so I'm super excited for the work that team has been doing, and the support that we've had across all of our departments. We were very, very intentional with that business case to really engage across, our finance, revenue cycle teams, our IS teams, as well as like strategy and other places, marketing. So all the resources that we thought we needed to make that program successful, we really included it in our business plan, and we've continued to work and partner with those departments as we've implemented. And so to see the growth of that program as fast as it's been, as well as I think the impact long term that we'll see for patient and just our team in general.
Yeah, how are you a liaison with the independent pharmacies around the state?
Yeah, so I think Arkansas has a very, very strong independent pharmacy voice, and I would say probably the strongest like number of independent pharmacies, and so we've been able to do a lot of great work. I think one of the biggest things I always tell our team as well is that we're in Little Rock, our patients are all over the place, so really making sure we're engaging with those independent pharmacies, making sure that just pharmacy in general, that we have a strong community retail pharmacy base across the state. Because our patients can't necessarily always get back to Little Rock for those medications. And so, we have a strong Arkansas Pharmacists Association. We have great relationships with them. Pharmacy itself, most pharmacists say it's this very small world. So we can easily a lot of times pick up the phone and call, a neighboring pharmacy, especially if a patient is having any issues getting any of their medications.
I think another important element of really any specialty program is an effective prior authorization process. And, there's ongoing action at both the federal and state levels to streamline that PA process. And certainly that's an agenda item for the American Hospital Association. And EHR vendors have also been working on improving the process. How are you guys approaching PAs with your program?
Yeah, so we, started the program actually meeting with all of our clinics, really trying to make sure we understood the current processes they had in place, and then the advantages that they would see as we implemented the program. So we were able to utilize our electronic health record. We have what's called a multi-step process within Epic, where before the prescription is even prescribed to the patient, so before that medication is prescribed, our team is notified that they want to start therapy, and then our team really takes over the process from there. And what I mean by that is that they are assessing to determine with that patient's insurance what would be covered, and then what pharmacy it would need to go to. So can it be filled with our specialty pharmacy, or does it need to be filled at an outside pharmacy? And so through that work, I will say they've been able to really look at our electronic system. We also were really good about implementing Compass Rose, which is basically a module within Epic that was really built to help support specialty pharmacy services. So once the PA is approved, our team utilizing that system can actually see the PA process across the continuum, and then they can continue to keep up with that PA process for renewals. So really making sure we optimize our electronic record for that process. And then I think the other part of that is just the team process of that. So if you look at our specialty pharmacy team, as we've been onboarding new staff members, most of that team member has a significant knowledge and actually experience within retail pharmacy. So their knowledge of prescription drug benefit managers, the claim adjudication process, right, and just the day-to-day operations of a retail pharmacy, I think has actually also been extremely beneficial for that team. So they have had most of their PAs, for the most part, we're at 99% approval rate or above. And so they've been really successful in that process. It has also, I think, improved the team experience, right? So within those clinics have now been able to take positions that they were likely dedicating to the prior authorization process, and now extending some of the work that they're doing beyond that PA process, because we're offloading that from the clinic staff.
Fantastic. You highlighted revenue cycle as part of your high-cost drug group, but revenue cycle linkage is another key to specialty success, certainly. How are you approaching this area?
Yeah, so we have a really, really great relationship with our revenue cycle team, especially if you look at even our medical PA sides, our authorization team really, really supports our medical, particularly clinic administered medications through our clinics and our infusion center. So we have tried to make sure that they are engaged across all of our programs. So even you look at specialty pharmacy, we actually walk through their process of the PA process initially to just make sure that our teams wouldn't get confused from their process to our process, and what team members were handling those PAs. And then the other piece that we've been very intentional about too is making sure they're included in our discussions around like even our 340B program and the billing associated with that program as well. So really, really strong ties amongst the finance and billing and revenue cycle program. And then we also have a dedicated staff member, a manager within our department that really oversees our revenue cycle and revenue integrity program. And we've added some additional resources to start looking at what that looks like long term as far as growing our business operations roles within the department.
You mentioned the Arkansas pharmacy community as a whole, and certainly Arkansas is a national leader in supporting pharmacy practice with, the action to prohibit PBMs from paying pharmacies less than it costs to fill a script, and in taking action to prohibit drug manufacturers from imposing restrictions on 340B contract pharmacies, just two examples. Tell us a little bit about how Arkansas pharmacy has been able to be such successful advocates.
Yeah, I will say Arkansas Children's, from a hospital system perspective, was not as heavily involved, and we were very supportive of all of those initiatives. But I will say, just from a pharmacy perspective in Arkansas, at one point I think we had probably a higher amount of state senators and legislators that were actually pharmacists by trade. Again, the number of independent pharmacies we have in the state, I think, is also a benefit of Arkansas pharmacy. I talked to our local dean, a lot about, the foundation of pharmacy is community pharmacy. So although I'm a health system pharmacist, I understand that foundation has to be extremely strong for us all to be successful. And so I'm really, really proud when I go to national meetings and I'm able to say I'm from Arkansas, because we have been a leader as it relates to really being a voice around what supports the ability to continue to expand pharmacy services and support our patients, regardless if they're in the community setting or health system setting. We all impact each other's ability and care, right? And so we have some strong partnerships across the state. I think we've just had a really strong advocacy within the state. And so I think when you look nationally, but also locally, they look to pharmacists really to make sure that the work that our pharmacists are doing is protected from the standpoint of payment models and things like that.
You talked about, one of the biggest challenges with the pediatric population early on in this session being financial. And certainly the high percentage of Medicaid patients compounds that. I think the extension of the 340B program to children's hospitals as part of the Affordable Care Act has really been an important resource to help ensure consistent services to all your patients. How do you approach compliance and optimization of the program to best meet program intent and the needs of your patients?
Really the collaboration, right, across both pharmacy departments within our system. But if you think about like our purchasing coordinators and making sure that they're well trained about the program, within our 340B oversight committee, we have representation across finance, revenue, compliance, IS, as well as legal. So we've been really intentional about making sure there was a lot of transparency within our program as it relates to compliance associated with 340B. And then we were also intentional about the roles that we brought into the department. So several years ago, we actually brought in a business operations manager. That position is really, really dedicated. Majority of their time is spent in overseeing the 340B program for our system. And then within that program, we have 340B analysts. And so those analysts have some dedicated duties, but we've also cross-trained them so that we're building out subject matter expertise across the program, whether it's our mixed use program or contract pharmacy. And then I think the other part of that is we've had a continuous relationship with our consultants, and just making sure that they're continuing to be engaged. And so as we have questions, we're very intentional about, we still meet with them to go over our audits as we have questions that are coming up, the variability in the 340B program and the complexity of it. They continue to really support us, heavily within just making sure we stay compliant. And then I think the other piece of that is just making sure that we do a good job of highlighting the benefit of the program, right, as it relates to our ability to extend our community benefit. But also, if you think about the expansion and things as we grow, that there is the benefit of that program to the institution becomes really, really important when you're thinking about advocacy around the 340B program.
Are you doing anything to promote how you're actually using the program back with your legislators?
Yeah, so one of the things that we've set some goals around this year is really developing some more what we call not really talking points, but I've tasked our 340B team to really capture some more specifics about that program so that we can create very similar to what you see from 340B Health or like the Children's Hospital Association, where we would be able to work with our government affairs group and our Arkansas Hospital Association to make sure that we have specific examples to provide that group of how the program is really benefiting from a pediatric perspective. I think we have great examples of some of the vaccine programs that we've done, how we've expanded a lot of our clinical services, but also just looking at specific medications, especially if you look at some of the retail pharmacy medications that we are able to provide at low to no costs, things like that, and making sure that we're able to provide those examples and the monetary value associated with those.
That is excellent work. Thank you. Andy, I want to be respectful of your time. Any last thoughts you want to get out to the Arkansas community, the national community, the pediatric community, or anyone else here?
Yeah, I mean, I think we always, want to make sure we highlight for Arkansas Children's is, our mission and how we champion children. This idea that we're going to make them healthy today, and then tomorrow and into the future. So I think we live and breathe that across our campus. And so there is a passion associated with when you walk on this campus. And I think as, if someone from Arkansas was watching this or nationwide, is how we advocate for our patients daily to make sure that they continue to be healthy, how we make sure we're looking at the use of medications for that, and the collaboration associated and necessary for us to be able to do that well and to be successful in that. And then probably the other part is that it really does take a team effort, right? So it's not just me as the pharmacy director, but I have a strong team both within the pharmacy, but also outside that we collaborate heavily with across all the projects and things that we do on a day-to-day basis.
Well, that passion comes through loud and clear in this session. So congratulations to you and the team at Arkansas Children's for really being pharmacy innovators. And thank you again for being our guest on the podcast today.
Thanks for having me.
Wow, that was great. You are really smooth, Kendrea.